Hello and welcome. We have a very special guest, a global detective of the very top kind, a detective who goes after microbes. We have the Chief of the Centers of Disease Control, Dr. Tom Frieden, talking to us. Dr. Frieden, welcome to the program. It is such a delight to have you back in India. You've traveled very extensively in India in your earlier avatar. What was your experience like at that point?
I was very fortunate to be here for a period of more than 5 years, traveling all over the country really to help the district, state, and federal government establish the revised National Tuberculosis Control Program, a program that has now prevented more than 3 million deaths in India.
3 million deaths prevented by a program which you spearheaded. I'm told when you were there, you traveled to almost every district in the country. So you probably know India better than America. Would that be a fair statement?
You know, I've never thought of it before, but I've traveled to a greater proportion of India than I have of America. Yes, I've traveled to about 30 of the states and about 250 or 300 of the districts. So that's a lot more than I've done within the U.S. even, although I have traveled extensively within the U.S.
Today, tuberculosis is a big problem in India. Still, I believe 1,000 people die of tuberculosis every day. We've sequenced the genome of the bacterium. It's a small little thing. Smart people like you and the incoming director of the ICMR, Dr. Soumya Swaminathan, are specialists on tuberculosis. Why can't we get it under control?
I think we have to be realistic about what we can and cannot do with tuberculosis. Unfortunately, we don't have a vaccine that will prevent it in adults. This would be fantastic. If someone could come up with a vaccine, it would be a Nobel Prize. We also don't have a treatment that is effective in less than multiple months. And we also don't have a way of identifying who's going to break down with it, who was infected 10 or 20 or 30 years before. So on the one hand, we've seen a very rapid reduction in death. It's no longer 1,000 people a day. Still far too many, but no longer 1,000 a day in India. We've seen a rapid reduction in the people who had TB for years and were around with it, what's called prevalence. But we've seen only a gradual reduction in new cases. And that's why I met today with the national program and listened to their ideas on how can we accelerate that downward trend. But there are some things that people should know. First off, if you're coughing and you think you might have TB, insist that someone test your sputum for it, because neither a blood test nor an X-ray can give you any definitive information. Only a sputum test can. There's a lot of overdiagnosis of tuberculosis in the private sector. And second, if you've got tuberculosis, take the entire course of treatment. It is curable, but only if you take the treatment. The single most important thing for tuberculosis, both for the patient and for society, is persistence. For the patient to persist in taking the medicines even after he or she feels completely fine, and for society to persist in running and expanding a good, well-funded tuberculosis control program, even if it's not in the headlines.
Is there something India can do to ramp up its program to bring down it's the tuberculosis capital of the world?
Looking at ways to better involve the private sector, improving diagnosis, ensuring that every patient diagnosed is put on treatment and followed till cure. There's no magic way of turning it around. It's hard work that has to be done right day in and day out for a program to succeed.
Hard work like you did. I believe you never slept when you were here in India. You worked 24/7, 7 days a week. Is that correct?
No, that's not correct. Everyone needs time off, and everyone should take time off so they can work more effectively. But it's a privilege to have the opportunity to be back in India and to work with Indian doctors and nurses and scientists who are so dedicated to making progress here. And there have been so many progresses in India, but so much farther to go, as every country has farther to go.
See, there are so many emerging diseases. Is there any few diseases which you think India should be very alert about? Tuberculosis is one, malaria is one, but the other diseases which are emerging from the forest slowly but steadily reaching inside?
Rather than any one disease, what's very important for us to address is being able to catch whatever it does, to detect whatever does come out. because we can't predict with certainty what the next disease will be. We can predict there will be a next disease. So having in place the tracking systems, the laboratories, and perhaps most importantly, the disease detectives. That's why I'm so happy that India has started an Indian Epidemic Intelligence Service program. That program is critically important because that allows India to figure out what its problems are and intervene quickly. In fact, that program was able to crack the case of the horrific outbreak of encephalopathy in Muzaffarpur and determined that it was coming from lychees and saved children's lives by preventing that from happening in the future.
But these detectives which you have trained, and the CDC and the Indian system which trains, are they good enough for a 1.2 billion population? Because we keep getting these scares of pandemics, and when I talk of pandemics, there is a lot of worry in India that some of these pandemics are really either false alarms or alarms where they are raised more as boogies, and end of the day it's pharma companies which make big money out of them.
Well, first off, no, we don't have enough epidemiologists. We need to grow these programs, this program in particular, but what we found globally is you can't grow too fast because it's an intensively mentored program. Each person who goes through it is mentored over a course of 2 years by someone who's gone through the program before. So it has to grow little by little rather than by leaps and bounds, but it can grow a lot faster than it's been growing, and that's very, very important that it does. In terms of the concerns, I rather think the concern is more that unless there's a fear of pandemics, there isn't enough investment in public health systems, in laboratories, and disease detectives, and tracking systems. But it's very important that any decision that gets made is made very openly. So there's transparency about the data, how it's made. For example, in the US, we have a system of deciding on vaccines, which vaccine will be used. Every meeting is open, all of the documents are open, so that there will be people who are suspicious or objecting, but at least we've put sunlight in, and sunlight can often be the best disinfectant.
Yeah, sunlight can be the best disinfectant, but if there is issues like what happened in swine flu, where the severity was not assessed, and I understand that it was more an issue with the World Health Organization and not so much with CDC, but it created a problem where next pandemic, when it comes along, somebody like me, what do I tell people? It's a false alarm.
Well, I think that's not the case with the H1N1 or swine flu pandemic of 2009. This, first off, was a big surprise in that it emerged from Mexico. No one expected it to emerge from Mexico. That's a lesson. Every country needs to track for emergence.
Ideally, it should have been called American swine flu.
So also initially, when it emerged, they only knew about the severe cases. So when Mexico first reported it, it looked like a lot of the cases were severe. But in fact, it wasn't a mild flu. It was a severe flu for younger people, in the US at least. We had over 1,000 deaths of children from this flu, so it was not a mild problem, but it could have been much worse if older people hadn't had some immunity to it.
Yeah, but end of the day, it didn't transcend into a pandemic of the kind which people were talking about. And you also raised it in the case of Ebola, where CDC called it an exponential increase would happen, and that didn't happen in Ebola.
Well, actually, it did happen. Ebola was increasing exponentially in July and August and September. And then because the world surged in, it broke the back of the epidemic and it came down. And we're still fighting it with 150 of our staff in the field today, but I'm optimistic we'll get over the finish line.
Yeah, but you got it wrong. There was no exponential increase of the kind which you expected with millions of deaths.
No.
There were no millions of deaths.
No, we said very specifically, unless urgent action is taken, this is what could happen. If urgent action is taken, this is what could happen. In fact, what did happen was that urgent action was taken. President Obama directed a response, including the Department of Defense. We surged in staff, others surged in staff, and as a result, we were able to prevent the worst case scenario, which could well have happened. It almost got out of control in Nigeria, but for a very rapid and effective response.
Talking of Nigeria, one of the important success stories for India is polio. And CDC has played an important role in India becoming polio-free. But there is an issue about our neighbor Pakistan having polio, while we worry about terrorism being imported from Pakistan with Kalashnikovs and AK-47s, but there's a teeny-weeny virus which can also come in. Is there some ways we can control the entry of that terrorist?
Well, the key thing is to keep your defenses up by vaccinating and continuing to vaccinate, and that's what India is doing, to keep the immunity level high so that if there is an import from anywhere, it would not spread widely here. At the same time, we're supporting Pakistan to help them get over the finish line, as Nigeria apparently has and as India did.
And do you think Pakistan would get over the polio problem soon?
I certainly hope so. I was there not too long ago. There are many very dedicated healthcare workers, doctors, and others. The violence is a real challenge there, but they're very committed to getting over the finish line and making an absolute effort to do so.